Good morning everyone. I am Sonam, Nursing Department from RPIIT Medical and Technical Campus. So today we are discuss about the hyperemesis gravidum. So firstly, what is hyperemesis gravidum? Hyperemesis increased vomiting gravidum in pregnancy. So means increased vomiting during pregnancy. So firstly we are discuss about the introduction. What is introduction? Nausea is the unpleasant, painless sensation that one may potentially vomit, and vomiting is an organized autonomic response that ultimately result in the forceful expulsion of gastric content through the mouth. 50 to 90% of pregnant women report having some nausea in their first trimester, and more than 40% report vomit. Vomiting usually begins around the 5th to 6th week of pregnancy, peaking at 9 weeks and usually resolve on its own by 16 to 18 weeks. Next is definition. Hyper means over, emesis means vomiting, and gravidum means pregnancy. So that is clear that vomiting, excessive vomiting, severe vomiting is called hyperemesis gravidum and occurs approximately 3.5 per 1,000 pregnancies. Next is degree of nausea and vomiting during pregnancy are mild, moderate and severe. Mild in evening or morning, mild emesis gravidum. Moderate with meals, moderate emesis gravidum, and severe frequent more than times of the day. Next is the causes. Causes like that high fat diet, psychological causes, genetic causes, ovarian hormones, estrogen and progesterone causes, reduced mortality and secretions, serotonin level, high level of HCG, liver dysfunction, and allergy of corpus hormones. Next is causes. First we are discussed about the genetic causes component. Sister and daughters of women with hyperemesis have a higher incidence. Hormonal high human chronic gonadotropin hormone stimulate the chemoreceptors, triggers John in the brainstem, including the vomiting center. This is the most accepted theory and proved by the higher frequency in the conditions where the HCG is high, such as in early in pregnancy, vascular mole, and multiple pregnancy. What is multiple pregnancy? In which one and more than fetus are in our uterus is known as the multiple pregnancy. Like that twins and triplets is also known as multiple pregnancy. Next is allergy to the corpus luteum or the least hormones, as increased estrogen level affect the part of the brain that control nausea and vomiting. Next is deficiency of adrenocortical hormones and vitamin B6 and vitamin B1. Next is nervous and psychological due to psychological rejection of an unwanted pregnancy and fear of pregnancy or labor. It is more common in gravida. Hyperthyroidism, most probably because of the thyrotropic action of human chronic gonadotropin hormones, and high fat diet. Women with a high fat diet are a much greater risk for developing hyperemesis gravidum. Their risk increase 5 times for every additional 15 gram of saturated fat, such as quarter pound they eat each other. Helicobacter pylori, 90% of pregnant women with hyperemesis gravidum are also infected with the bacterium, which may sometimes cause stomach ulcers. Gastrointestinal changes like that entire pregnancy, gastric dysrhythmias have been associated with morning sickness because the gastrointestinal tract is more sensitive to the neural hormonal change, acid reflux, and the stomach empties more slowly. This can cause nausea and vomit. Liver dysfunction. Liver disease, usually consisting of mild serum transaminase elevation, occur in almost 50% of patients with hyperemesis gravidum as a cause or result. Next is pathophysiology of severe vomit, morning sickness. If morning sickness is arise, it is excessive vomiting. If excessive vomiting is arise, then create two, dehydration and starvation. Firstly, we are discuss about dehydration. If dehydrations occur due to hormone concentrations and raised blood urea and oliguria diminished in urine. And if starvation is due to ketosis, hepatitis, emaciation, polyneuritis and wrinkle encephalopathy. And if dehydration occur, it is due to urine में what changes are come in urine, oliguria, concentrated urine, lower uric chlorides, ketonuria, proteinuria and bile salt. Next is sign and symptoms are arise in hyperemesis gravidum are the patient can't retain anything in her stomach. Vomit occur throughout the day and night even without eating. Thirst, constipation and infrequent urination. In severe cases, vomitus is bile or blood stained. Finally, there are manifestations of vernix, encephalopathy or drowsiness, nystagmus and loss of vision then coma. Loss of weight, loss of 5 or more pound over a 1 to 2 week. Sunken eyes, dry tongue, dry mucous membrane and inelastic skin. Gums covered with sores, breech abdomen smell, late slight jaundice, pulse rapid and weak, blood pressure low, temperature slight rise. Diagnosis in obesity. Firstly, obstetric ultrasonography is usually warranted in patient with HCG elevate for multiple gastations or trophoblastic disease. Urine analysis for ketone and specific gravity, a sign of starvation. Ketone may be harmful to fetal development. High specific gravity occurs with volume depletion. Urine culture. This may be indicated because urinary tract infection is common in pregnancy and can be associated with nausea and vomiting. Liver enzymes and bilirubin. Elevated transmittance levels may occur in as many as 50% of patients with hyperemesis gravidum. Mild, significantly elevated liver enzyme, however, may be a sign of another underlying liver condition such as hepatitis, ischemic, or some other etiological of liver injury. Blood values to note: degree of anemia mild 8 to 10 gram, moderate 8.7 gram, severe 7 grams. Antenatal fetal monitoring. Antenatal fetal well-being assessment is done by ultrasonography for fetal growth and liquor pockets, cardiotocography, umbilical artery flow, velocimetry and biophysiological profiles, X-ray chest for pulmonary tuberculosis. Next is management. We are discussed in our next session. Thank you.